Hi, good afternoon, everybody. This is Eric with American Business Systems, and I want to welcome you to today's webinar. We're getting started here right up at the top of the hour and look forward to getting into this specific topic today because it deals with us going into 2016. We're on the cusp of wrapping up 2015 here. So obviously, Patrick and I thought, wow, what a great webinar we can present today of actually talking about some of the real facts, some of the real issues that doctors are faced with, not only today, here at the end of 2015, but what's going to be transpiring over here as we get ready to go into 2016. So obviously, we're going to talk about the challenges facing doctors here in 2015. And so, folks, what you're going to be looking at today are some statistics, some articles that we've found here recently, and we want to make sure that you get this information and educate you on helping you as you're making your decision to whether to get into the business of medical billing, medical revenue cycle management, however you want to call it, and see if you can help these doctors get started here. Again, for those who've never joined us here on our webinar and you've never met me, I'd like to introduce myself. My name is Eric Auger. I'm the Director of Research and Development here at American Business Systems, and certainly welcome you here today. I'll be one of your hosts along with Patrick today as we get started on talking about, again, challenges doctors are facing going into 2016. As we get started here, obviously we want to make sure I'm being heard. And we've checked all the sounds on our end as far as we know that we're being heard, but we want to hear from you. And the quickest way for us to see that right now is if you'll click that little hand. So I see some hands going up there already, and I'll start calling out some names here as some more hands start going up. So if everybody will pay attention and get up over there on the control the control panel, find that little hand, click that hand indicator. That'll raise your hand. That gives me feedback to know that I'm being heard. So I see Latoya, good to have you here this afternoon. Ron, thank you. Tom, I appreciate it. Stephanie, good to have you here this afternoon. Jeremy, Michelle, thank you. Donna, there's other folks here. George, if you'll raise your hand there, I'll see you. Cecilia, Bill, good to have you here this afternoon. Pretap, good to have you here this afternoon. So obviously I'm being heard. Thank you for helping me. Give me a little bit of feedback to make sure that, again, we're all being heard here today. Let me tell you a little bit about American Business Systems, who we are, what we're servicing, what we can help you with, and the services that you'll take and to help these doctors as they're facing some of these challenges, again, going into 2016. To find out about these different services, you want to go to our website at absystems.com. You'll see there, right next to About Us, you'll see about the business package. And that will tell you everything you need to know about each of those services that we're going to be talking about today in a little bit more detail. And obviously, you can go and watch that video there and listen just real quickly of a good general overview. But again, through our entire website, including that little button up at the top where it says Take the eTour, that'll let you get into even what's further some due diligence called our virtual brochure. You can go do some of that. As you're doing your due diligence, obviously you need to go check out the company that you might get into business with, and we certainly want to direct you to the Better Business Bureau here at Fort Worth. You'll find that we are and still maintain an A+ rating, so go check us out there. You'll be able to read some feedback, some good feedback, not just from the Better Business Bureau, but from those that are part of ABS as licensees. Go check out what they're saying about us, and that helps us maintain our A+ rating. So, folks, that doesn't come easily. So we've been maintaining that for quite some time, and very proud of having that A+ rating. With that said, we have been servicing for the last now 22 years of helping licensees from coast to coast, helping them build their business, their dream, and being an entrepreneur in the medical revenue management sector here. And that's some of the things that we're going to be talking about today. And as you can see here, we've got licensees from coast to coast. But the other thing we want to show you is that there are actually no territory restrictions. So as you're looking for a business, whether it's in our business or any other business, you want to also know what your territories are. And so we wanted to show this particular screen to you because there are no territory restrictions for you. You could be living in California and have a doctor in Florida. You could be living in Texas and have a doctor in Boston. Wherever you might be, you can have a doctor anywhere. You can have one in Hawaii if you want to. It just doesn't matter. Doctors are in need, and what gives us the capability of doing that is our web-based system. You don't have to literally go to the doctor's office to load our system onto the doctor's computers. They log into it, and they have the most update, most refreshed system that's out there on the market today. And that gives you the opportunity to, again, be in one location and bill for a doctor in a completely different location. That's why there are no territories. And that's really why there's not much competition for you, because literally you could be living in Chicago and have a doctor in Timbuktu. It just doesn't matter. You can, your territory is as wide as the United States is. So, and again, the reason for that is because of our web-based system that gives you the power to be able to do that. Now, part of what we want to share with you is that we talk with you on a webinar on a weekly basis. And yes, you get to know Patrick and me fairly well through these webinars, and we try to give you as much information as we can. And as you'll see here, you can actually come to one of our training workshops, but we know that people like to come and make sure that we're real and we have a real office and that we're not a scam or anything else like that. So we want you to come by our office. You can see our address right there below it, 5751 Kroger Drive. We are just north of Fort Worth. So if you'd like to drive, if you're within driving distance, whether 4 or 5 hours away, or if you'd like to fly in, you would fly into the Dallas-Fort Worth area. And instead of maybe even you renting a car, we'll see about arranging to come pick you up and bring you back to the office, let you meet the rest of the team, sit there and visit with us. We'd love to have you and come by, and certainly you can come by and visit with us. The other thing that I mentioned to you as kind of getting to know us is part of our live training workshop, and I'll tell you why this is important of kind of getting to know us, because I'll share with you at the end about the 100% money back guarantee. But our next live training workshop is next year, and you can see that it's in February the 8th through the 12th. And coming this next Monday, the Monday after the holiday weekend here, we will be 6 weeks out from that particular training. So, folks, it'll be here before you know it. You're going to get through the last part of the 2 weeks of this year. You get things settled in there for January, and then right as we begin February, we're going to have our first training workshop of the year of 2016. Folks, I'm already going to tell you that most of this class is pretty much full. We've probably we looked at how many seats that are already spoken for people who've already purchased, and they couldn't make it to the December training. They've already rolled over to the February training. So as we look at it, we probably have about anywhere from 6 to 7 seats left available for this training workshop. So we want to encourage you, if you're really looking forward to getting started, get your paperwork together, be one of those people that have their seats reserved for this live training workshop here in February of the 8th through the 12th. So after the webinar today, you might find it to be one of those things where you really want to get started and get started pretty quickly. And there's some things we'll share with you of what you can actually do. Let me share with you who is going to be my co-host today. Some of you know him, Patrick Phillips. He is the founder and the CEO of American Business Systems. You can see that he was a former Apple executive here when Apple was actually here in the Dallas-Fort Worth area. He is also an author of a couple of books and working on another book that's going to be very exciting, and that should be released here right after the first of the year. It's one he is actually co-writing with another doctor, talking about the challenges that doctors are facing. So that's going to be an incredible book that's going to be coming out here to help you with either making your decision or helping the doctors with some of the marketing that we can show you how to do that. He's a nationally recognized motivational speaker. He's been doing that for years, and he is also on the editorial board of what's called the Billing and Coding Advantage magazine. This is a real magazine. It's in real print. It goes out to literally thousands of medical billing companies, doctors' offices throughout the United States. And this is not an ABS thing. This is absolutely completely separate from American Business Systems. But he is on the editorial board and writes several articles for them, and he just had one here just recently go out last month. And he's also the founder of the Medical Revenue Managers Association of America. Well, why is that important? That's important to you as an ABS licensee, because once you do come through that live training, that is your certification. you will be at that point a certified medical revenue manager. And that's why he is now the founder of that. And that is a benefit for you. So when people ask, are you certified? You can absolutely say that you're certified as a medical revenue manager. So without any further ado, let me bring Patrick on today. Patrick, it's good to have you here. I know you've got a lot of things going on as we kind of close out this year, so thanks for taking your time out today.
Yeah, Eric, I'm always interested in folks who attend these webinars to find out if they're really seriously, dedicated to starting their own business, because that's the first step in looking into our business opportunity or a franchise or any other opportunity that's out there. Is you have to be committed to, getting involved in your own business, because unless you're just stuck working for somebody for the rest of your life, and have some goals to get independently wealthy. About the only way you can do that, unless you were born into wealth or you rob a bank, is to start your own business.
Sure. So did you have a poll that you wanted to start off with or anything like that, or did you want to get started right on into the next slide here?
Well, I can start this first poll. That might get the webinar kicked off. This is just asking folks, what's most important to you in starting your own business. You can select one or more of those items there. That'll register here on our side, and we will share that with everybody as to what the responses are. I see some people looking for the poll, obviously, but it is in progress now. So if you have gotten away from the window that has the webinar in it, you might want to go back and find that there is a poll on your screen. You can just click on one or more of those items there that are on the top, and then I'll throw the response up there as we get started. Eric, this topic is very important because as we enter into 2016, doctors are pretty worried.
Yeah, absolutely. So those are some of the things that we're really going to review today. And as we get kicked off here, certainly we know that as we go through this afternoon, there are going to be some questions, and people are going to want to ask you and I some questions about maybe some of the findings that we have here. And so we would actually love to get your response. And Hugh's already, thank you for sharing some information with us already, and I appreciate that. And so what we'll do here, if everybody can find that question box, you'll be able to type your questions in there throughout the presentation today, and we'll make sure to do our best to get these questions answered for you. But Patrick, let's maybe go to that poll there, and then we will get started in kind of seeing some of the things and some of the issues that doctors are really under some stress about.
Yeah. Well, as you can see, 100% of everyone on the webinar today has answered, that they want to be in charge of their own life. I think that's very important. People don't realize that, working for somebody else, they're in charge of your life.
Yeah, and then the second one that comes into place is both of the freedom to choose their own hours and time off and the income after retirement. I think, Patrick, there's no doubt any of us that we would consider ourselves to be in the baby boomer era right now, that is what's going to happen to our retirement. I mean, certainly we can't trust the government, we can't trust the IRAs that are out there. We're going to have to do something on our own. So that rang loud and clear right through there, certainly.
Yep.
So today, let's get started here as we kind of focus in on some challenges. And what we're going to share with you right now are some articles that Patrick and I have recently come across. One is actually one of the things that we actually found today. And so we'll do our best to kind of show you where you can find these yourself. But Patrick, this is one that we shared here recently. But this is, I think, one of the articles that actually Adam, the president of the company, found and shared this with us about economic pressures bolster case for outsourced billing. Why don't you explain that to us a little bit?
Yeah, this is on a website, by the way. It's what you see there on the screen, physicianspractice.com. As you can see, this came out just the first part of this month, December 8th. Yep. And what it's saying basically is that, I'll just read that first paragraph. Battling declining reimbursements and rising operating costs, many physicians are feeling the pressure to rein in expenses. However, Paying a third party to manage the revenue cycle is one cost that can actually improve your bottom line, experts say. So here's a website for doctors that doctors go to, and they are saying exactly what we've been saying for 22 years, Eric.
Yeah, exactly. And these are some of the things that we're going to be dealing with today. I mean, declining reimbursements, that's certainly one of the issues that we're going to be talking about today. The rising operational costs, we're going to be talking about that today, about being some of the issues that doctors are facing as we're rolling into 2016. And obviously, this is just something that it's a continuation as we're seeing our licensees get more and more doctors along the way. We're seeing that, but it goes on to say out of this article, and we've kind of pulled this article out so that we can read it a little bit better for you. So, but Patrick, this John Boland kind of expands on that first paragraph.
Yeah, and he says the greater the economic pressure on a medical practice, the more viable outsourcing becomes. Eric, the doctors are under tremendous economic pressure right now because they're not collecting what they used to collect. Medicare's not paying, and insurance companies are not paying what they used to pay. And the ICD-10 codes that just came out this year are causing doctors to be under a lot of pressure. So he says that the more pressure, the more viable outsourcing their billing, getting it out of the office, out of the hands of their own staff, not having to deal with all those things. And then he says outsourcing billing processes should ultimately reduce the cost of collections and maximize revenue, allowing a practice to invest in clinical resources and get better quality results. Great quote, Eric. This is I could have written this myself.
Absolutely. You people would think that we did, but again, you'll see up at the top there, we've got the web address there that you can write down. It's actually going to be on this next one because not only do we hear from this one gentleman in this article, but another person who is a certified coding instructor. Now, this is a person that's above certified coding professional coders. This is someone that actually teaches these people. And Nancy is saying the pressure to upgrade technology and to train staff has further complicated the process of billing. Many practices are looking to third-party billing companies as a technology partner to help them keep up to date with the changes in EHR, practice management systems, which is crucial to meeting quality standards and qualifying for insured-based financial incentives. That's a mouthful there, but let's just kind of drill that down, Patrick. I think what we can take away from this is doctors are looking to outsource, not just to outsource their billing, but I think one of the biggest things there is what she says, they're looking for third-party companies to partner with as a technology partner. That's what we're finding of our licensees becoming. They're not just there just to give them a billing service. They're really there to partner with the doctor in so many different ways.
Yeah, that's why when we hear the concerns that some people have about, well, I don't know if I could sell the doctor on my services. Folks, there's nothing here to sell. You are a consultant and become partners with doctors. And they want to deal with someone local that they can trust, that's been trained and certified, not only to collect their receivables, but to deal with all those issues that have to do with the electronic health records that the doctors are being forced to get involved in. We have the solutions to that, as you'll see here on the webinar today.
You know, Patrick, I know that what we know as the Affordable Care Act, what we all know as Obamacare, that happened. It's in play. We're going into 2016. It may change maybe on the presidential side of everything. Who knows what's going to happen here? We really don't know. But one of the things that we do know is because of the Affordable Care Act, this is just the minimum number that we've heard, 30 million uninsured Americans.
Yeah, nobody knows what the real numbers are right now as far as who's gotten involved, but the ultimate uninsured that are out there is 30 million Americans. Now imagine, Eric, just adding, sprinkled amongst the medical doctors that are in America, sprinkling another few dozen into their mix each month means that they're going to have to see that many more patients.
And that coupled with the shortage that we begin starting to see this year, about 60,000 doctors shortage for this last year, what this is doing for that particular practice. So what this is saying to everybody right now is that we've got a lot of people that are coming to the doctor. There's a doctor shortage. How does that deal with this whole billing revenue cycle management? It's a huge impact. It's because now it's almost like the doctors can't keep up with anything.
That's right. And it's not just the Affordable Care Act, as we'll see. There's lots of things that brought all this about on the doctors, and where they're now having a shortage of doctors. So we'll see what happens.
And Patrick, this is one of those other articles that we just came across today. And this is something that's not about American Business Systems. This is certainly third party. It's called the we didn't get a chance to. We found it here late in the afternoon. We didn't put it all up there, but it's the practice index, the performance practice index, I think is what it's called.
Right.
Talking about the key challenges. This could have been written for today's webinar. It's just amazing.
Yeah, because the biggest concern, as you can see right there on the screen, is declining reimbursements. 62% of all doctors are worried about the declining reimbursements. I mentioned earlier that Medicare, Medicaid, the government agencies are paying less. Well, so are the insurance companies. So the doctors are really struggling right now, and that was all brought about, of course, with Obamacare, the Affordable Care Act. And then right under that is the rising cost of running a medical practice. Over half of the doctors are concerned about that, and they don't know what to do about that. So, folks, we can help with that. We can reduce what it costs them to handle their billing by outsourcing it to you. You can charge anywhere from 4 to 8%, depending on the doctor and the specialty and so forth. And so that's a huge drop over what they're paying now, as you'll see from some other quotes that we have here.
Celia is asking, she has to leave. I think she got an emergency. Yes, you'll be able to listen to this webinar a little bit later. We are recording this. It'll be available tomorrow. So Celia, if you need to get going, you can go ahead and take off. But yes, absolutely, you can listen to this a little bit later. But Patrick, this is just we're just scratching the surface here on some of the challenges that doctors are dealing with. Folks, keep in mind, one of these issues is the ICD-10. Patrick, ICD-10 just went into effect October of this year, and some folks think, well, since it's kind of come and gone, that's probably not an issue anymore. Actually, it is still a huge issue, and we'll kind of get into that today. So let's talk about what we have found as what we say is the top 10 issues that doctors are faced with. Number one, simply just flat out getting paid.
Yeah. In other words, they're worried about getting paid, what's due them, what's legally due them from the insurance companies and, of course, the government agencies.
Yeah. Second is collecting co-pays and deductibles. Patrick, you would think that every doctor, as easy as we go to the doctor, that collecting co-pays would be the thing that it should be the easiest thing, but it's not. It's not actually the easiest. We find a lot of doctors that still their office is not just collecting the co-pays, and that could be a good chunk of money right there.
By the way, folks, we're going to go through each one of these separately, and you'll see that we as a company and you as a licensee of ABS will have the solutions for every one of these.
Yeah, so we see 3 and 4 is administrative burdens, rising operational costs. This is really important, Patrick. Everybody's wondering, well, aren't these doctors selling out to hospitals? Independence versus employment, keeping pace with technology, HIPAA, implementing ICD-10 codes, EHR, EMR. What's that? What does it cost the doctor? And then payers. We're talking about the insurance companies dictating healthcare. Patrick, I think you've got another poll there real quickly about HIPAA. You want to throw that one up there before we get out? And let's
see if folks watching the webinar today, how knowledgeable they are about that term. HIPAA is how it's pronounced. Of course, it's an acronym for something. And there we've given you 5 different choices there that you can pick from. Let's see how many people actually know what HIPAA represents. It's one of those 5. You only have a choice of one. And while they're doing that, Eric, let me just say this. I'll give everybody a hint that it does have to do with the patient privacy. Our system, of course, is 100% HIPAA compliant. which means that we have followed all the rules and regulations that's necessary to make sure that the patient data is not only backed up on a regular nightly basis, but actually has redundant servers that all the data is on, so you can't possibly lose anything. And of course, it's well, I started to say hack proof, but I don't guess there's anything in today's world that's really truly hack proof. But so far, HIPAA has not had any hackers wanting to get into systems like ours to get the data.
Absolutely. All right, you want to end the poll and let's get the right answer out there for
Yeah,
them?
let's close that out and share the results. Here come the results in just a second. There they are.
There we go.
And it's almost it's almost that we had only two choices there, and it's actually the second one. Yeah, it's called the Health Insurance Portability and Accountability Act. Now, it does have to do with privacy, but that's just not the name of it. If you look it up, it has to do with the portability of that patient data. How electronically portable is it from one system to another?
Yeah, so there you go, folks. You've learned something new, and as we get started here, we're going to tackle this first one, just doctors getting paid. And what we did on this particular one, we broke it down into 5 areas. And the first one here, Patrick, is the patient isn't eligible for services or haven't shown proof of insurance. What does that mean?
Well, it means that their insurance company doesn't cover that particular procedure that the doctor has to provide to that patient, or they haven't shown proof of that insurance to the medical practice, so the medical practice doesn't know how to bill for that.
Right, and you would think that would be one of the most
first things they check.
First things they ever do.
Yeah.
Number 2, claims are missing codes, and biller is using invalid codes.
Yeah, this is a big problem. Most people don't realize how many claims are sent into insurance companies and to Medicare that are rejected because the codes are not even there, or the biller is using the invalid codes. Now, the great part about all this is our system has all those codes built in. You don't have to know anything about coding. The doctor is the one that's supposed to provide the codes to you, but if they don't know what the codes are, our system will tell them.
Yeah, and then a particular service is simply not covered by the insurance, which means in just our layman's terms, what the doctor says is wrong for the patient doesn't match what the doctor did for the patient. So, folks, it's amazing that, these are some of the issues that we're finding that physicians are just not getting paid. These are the things that are hindering that the doctor's performing services, but it's just not being translated to the insurance companies in order for those insurance companies to actually say, yes, doctor, I'll pay you for what you saw that patient on.
Yeah. Like the doctor might have put a code in that said something about the patient, has a broken arm, but what the doctor did for the patient was to give them some kind of medicine that has nothing to do with a broken arm. So that wouldn't be
right. Right. And then, I think we've all been to the doctor, and we have to, some doctors or some procedures that the doctor needs to do for us, the doctor's office didn't seek prior approval before seeing the patient.
They have to make sure that particular patient's particular insurance company will cover that particular problem. Yeah.
And then the last one has to do with completing the patient's information. Patrick, one of the top things that will guarantee a doctor not to get paid is they've got the wrong patient information. And we're talking about the wrong patient information, we're talking about something as simple as misspelling of a last name.
Yeah, or the social security number if they've gathered that from them, or even sometimes the address, it just doesn't match up, and so they go, sorry, we can't pay this. This is not what the insurance company says this patient's address is, and so it gets rejected.
And so what we read out of here at the New England Journal of Medicine, what this equivalates to in dollars, we're talking about 24 cents of every dollar is going to be wasted on some type of administrative and billing expenses. When somebody has to go back and fix that because it was done wrong in the first place, it's costing the doctor not just not getting paid, but then it's costing the doctor in a long run. It's amazing the amount of lost revenue that the doctors are finding themselves because of these issues that we just talked about.
Yeah, you see all those people running around in a doctor's office behind that glass, you know. If you're wondering what most of them are doing, most of them are dealing with the insurance and the billing and all the things that have to do with the coding and so forth for the patients. That's a huge chunk of that 24 cents out of every dollar. And like we said earlier, you can charge as little as 4 up to 8%. That's generally the nationwide average for billing companies. And that cuts that expense way down for the doctors.
Yeah. So as we stated, what we're going to do is talk about, first of all, the issues that the doctors are faced with. And we see the first thing is just not getting paid. And then the solution that you, as an American Business Systems licensee, will be able to have is to bring them a platform that will deal with all 5 of those issues that Patrick and I just talked about, including making sure that the patient's demographics or the patient's information gets in the system properly, because we're actually the only platform that can literally go to the insurance companies and pull that information into our system so that we've got good patient demographics in the system. That separates you from all other medical billing companies out there.
Yeah, you shouldn't assume, for example, folks, that the software that the doctor might be using in their own office has the ability to do that type of thing that Eric just mentioned. Go grab the data from online in real time from the insurance company's database. Most of them don't. Ours does, and it does a whole lot of other things that the office usually is very amazed at what it can do for them. And those are the little things that will make their revenue increase.
Yep. Make their lives easier, make them more money. That's what it's all about. Let's get to number 2 here, collecting copays and deductibles. Patrick, when we first read this, I just thought, this can't be. But we're talking about just simple a $25 copay that's not being taken care of. And this is actually just an amazing issue that we're finding with doctors.
Yeah, it's because most systems don't remind those staff people there at the doctor's office that they need to make that copay collected from the patient. And if they fail to, they don't have a way to go back and make sure that that gets collected from the patient even after the visit. Ours, again, has all that built in with our auxiliary services like Quick Collect, for example.
Yeah, and so here again, we're addressing the Affordable Care Act as one of the potential burdens that is still plaguing our doctors going into 2016, because again, you can't keep up with the Affordable Care Act, trying to figure out which patients have actually continued to keep paying their monthly premium, and so the doctor's offices are still finding themselves sort of behind the 8 ball. And this is not from us. This is a quote that's coming from the American Medical Association, and it's telling the doctors, and it's warning that physicians will get stuck with bills from patients who are taking advantage of medical services during that time, but then fail to pay premiums.
Yeah, so someone may say that they're covered by the Affordable Care Act. The doctor has to take their word for that because there's no main database that they can go to see that. And then, of course, since they didn't make the premiums to the government for their Affordable Care Act coverage, then, of course, the insurance company is not going to pay the doctor what he bills them for.
Right. It's just like anything, folks. I mean, people will buy something for a little bit just so that they get the card, and they can show that card to that front office, and that if that front office is not paying attention, they're going to say, oh, okay, this person has insurance, and let that person see the doctor. But whenever it finally gets over to the billing and someone does the billing for that particular claim, that's when they find out that they can't get reimbursed because that person wasn't eligible to actually see the doctor. And then with that, coupled with that, even from the professional coders are saying that, again, on top of all of this, claims are just being rejected, and the amount of these claims that is causing all this is up to and above now 34%. So we're talking about...
That's a third of all the claims that are sent in by medical offices are rejected by the clearinghouse first, and then of course by the insurers themselves. We solve that problem too, don't we?
Yeah, absolutely. And it can actually be solved a couple of different ways, but we wanted to kind of showcase some things that we just don't normally talk about. Obviously, that can be taken care of in the iClaim system, but we also have another solution, another ancillary type of service that can be done for the doctor, and that is through ChoicePay. Patrick, you want to kind of talk a little bit about what ChoicePay can do for the doctor's office?
Yeah, this service just gives options to the patients so that they don't have to pay, for example, the entire bill up front. Maybe they don't have the $300 that the charges were today, but they want to pay. This gives them the ability to do that, and they can even go to our online portal here and sign in and make their payments.
Yeah. And it could be a high deductible. Maybe they're, especially here. Let's talk about that real quickly because this is important. So, folks, get off your other web pages that you're looking at right now and kind of listen to Patrick and me just real quickly. Folks, we're getting at the end of 2015, we're going into 2016. Guess what happens? Everybody's deductible starts all over again come January 1 of 2016. And if they didn't get their surgery or whatever, they lose that deductible and they have to start that all over again. So they may be going in for a surgery and there's a $2,500 deductible. This is where the solution of ChoicePay can help that doctor collect that deductible over a period of time and do that through a web-based system. So it is an incredible asset for that doctor to kind of help with the cash flow.
Yeah, Eric, I might just mention that I'm glancing at the questions that have been put on the question board there, and some of them, of course, we know that we're going to answer. Like Hugh, you can see that we've actually answered your question here by going into some of the solutions. He says, I'm assuming you have a full suite of solutions in addition to just medical billing.
Yeah.
So yes, Hugh, we've done it. And so if the others who have put in questions, if we haven't got to them yet, it may be that we know that we're going to answer those at some point in the webinar.
Yep. All right, so now let's talk about the administrative burdens. Again, this is a new article that just came out, and this one is talking about the administrative tasks that continue to weigh physicians down. And you may not get the graph, but the graph is basically showing that 2/3 out of all these numbers here, which is about 64%, spend more than a day or more per week simply on administrative tasks. We're talking about the physicians, not their office.
Yeah.
The doctors themselves.
Imagine that, Eric, that they have to spend a day out of their week just dealing with the administrative tasks, which again goes back to mainly it's dealing with the insurance companies and Medicare and trying to get the revenue in that they know they should have.
Yeah, so folks, time is money for a doctor. The more patients that they can see, the more money that they can make. The less time that they have having time to see patients, it just means less money in their pocket. And so what you're able to do is take away some of that administrative burden. This article, I mean, these next two quotes, Patrick, I'm going to let you take because we couldn't say it any better, but this is coming from a doctor by the name of Michael Murphy.
Yeah, he says, I can't stand saying it, and I can't believe physicians say this, but patient care has almost gotten in the way of the documentation and charting. Now imagine, patient care is what they should be focused on, but doctors have to get into the documentation and charting, which is all the things that our system does for them. But he's right. That's the fact.
And he goes on to say, this is why, it feels like it's what's driving physicians to sell their practice. And on average, you're seeing about 25% sustained productivity loss around the country. So it's, Patrick, I know of one doctor here in the Dallas-Fort Worth area that after they spend the day seeing patients, they'll take another 2.5, 3 hours after hours to do all of the administrative work.
Yep.
So doctors get there about 6:30 in the morning. They see all their patients throughout the day. They get wrapped up about 5:30, and then they'll spend another 2.5 hours in the evening just trying to wrap up. When most of us are home having dinner, doctors are still doing that.
Right. So 1/4 of their productive week is taken on focusing on all of this paperwork.
So what's the solution? Kind of gets to what he was asking. What about all these different? We threw everything up here to kind of say each one of these can be very specific of helping that entire administrative issue, whether it's iDocs Now, whether it's Quick Collect, whether it's Choice Pay, whether it's CodeWrite, Audit Guard, EMRX, iClaim, whatever it might be. It's the full suite of everything that we have, Patrick, that can actually help reduce a lot of that administrative burden.
Yeah, so over the last 22 years, folks, what we've done basically is as we've come up through our licensee base to these different challenges that doctors have, we have looked for, partnered with technology partners that can solve those things through these services here. Now, you don't have to offer any of these services. All you can do is just the billing if that's what you want to do for a doctor. But believe me, this is a great door opener to be able to say that you can solve any of their problems, any and all of their problems with our solutions. So great. In fact, Eric, we're working on a couple right now, new ones.
Right. Well, yeah, we certainly are. One of the things that we stated in that previous article that Patrick started off with that we read from December the 8th, one of the first things it says, rising operational costs. Where do we get this information from? Medical Economics. It's a website. You can go out there and look. But look what it says. More than 84% of physicians surveyed by Medical Economics says that their practices are doing the same or worse financially than a year ago, according to the Medical Economic Physician practice.
I mean, that's a huge number, Eric. 84% of doctors are doing the same. They haven't grown. They haven't solved anything as far as revenue problems. Or they're worse financially than they were a year ago. So that's good news for us and our licensees, but bad news for the doctors, of course.
You know, Patrick, as we're going through this, this is one of these webinars that you and I probably ought to do ever so often because this information just doesn't go away. And we're finding out, again, through these resources that one of their number one challenges is because of the requirements, again, of what? The Affordable Care Act. I mean, here we go again. We're dealing with Obamacare that 49% of physicians are reporting seeing their profits at their practice dip, again, to the practice profitability index. That's where we got the other information from today that we shared with you on this information.
Yeah, Tom has asked this question just a few minutes ago, so I don't know exactly what he's specifically asking about, but he says, is this true for all sizes of practices?
Yes, I think I got what it doesn't matter if it's a single practice or if it's a group practice. We're talking about if it's happening for a single physician, it's happening for a group practice of 10 doctors. It is.
Yeah.
Matter of fact, Patrick, I just heard about this last week that there's a group of doctors they were being reimbursed about $125,000 per month, and since the change in the ICD-10s, they've seen a reduction from $125,000 per month to $75,000 per month.
Wow, that is a huge drop.
That's a 50 grand change. So yes, Tom, it's the single practice or group practice. That's what's occurring.
At least that's what we're hearing from our licensees. Remember, we have licensees that bill for single practice providers, and then of course they've got practices that have what is our biggest one? I don't know, 40 or 50 doctors in the practice. Yeah.
Yeah. And here again, it's showing about the ICD-10 being more complex, resulting in more software and training costs, and now, as we'll see here, now implementing that, it's actually driven the revenue down again. And then challenge number 3, most physicians, 85%, have transitioned again now to some type of electronic health records, or what we know as EHR or EMR, to comply with what's called meaningful use. This is the governmental compliancy. It's putting a heavy burden on docs. And what it says there in the article, this isn't cheap, and it's really impacting the doctors.
Yeah, because we've done some studies, or medical economics has, that show from the Michigan Center for Effective IT Adoption says the average 5-year total cost of an in-office system is $48,000, and for a cloud-based system, it's $58,000. Eric, when people find out how little it costs really for a doctor to get involved with our system, it's thousands of dollars less than 58,000, of course.
Right. And folks, whenever you're going through our virtual brochure or anything on our website and you see the cost, operational cost, and you see that there's a certain cost, folks, that is a cost not for you as a licensee. That's a cost for the doctors. But if you take those numbers, you're going to find out that it is 80 to 85% less than what we're showing you here on what is the doctor's cost for having an EHR system. So it's incredible of what you're able to provide the doctor, because the less cost it is for the doctor, the more money that they get to keep. That's what it gets down to be.
Well, and that's why this next quote is important, because folks, you have to realize that 70% of all physicians says that the transition to electronic health records was not worth it, and they would not purchase their systems again because of poor functionality and higher costs. When we go in and show them what ours does, the leading edge technology that ours has, and how much less it is, they can hardly believe it. And Eric, that brings up the fact that if people haven't seen a demo of our system, they should ask their ABS business consultant to give them a demo.
Yeah, we'd love to take you on a tour of the EMR, which is it's called EMRX. We can do that for you just about any time. If you haven't had an opportunity to see that, you certainly can be able to do that. I know that one individual that's on the webinar today, Danny, thank you for joining us today, but I just did a demo for him today and showed him this. So if you're seriously looking at this business, you need to see what the system can do and help with these issues that we're talking about with. Patrick, we're on number 5, and I'm looking at the clock. We've got about 15 minutes left with the webinar today. It's amazing. Wow. So we're going to do our best not to rush through it too terribly much, but we are going to kind of pick up the pace a little bit. Let's talk about doctors staying independent versus, joining some big practice or being bought out by a hospital.
Yeah, we have found out, folks, that joining the hospital system is not a solution for the challenges facing physicians. In fact, we have many, many licensees that have signed up doctors who were working for a hospital and then realized that everything was not quite what it should have been. I think our next slide shows that. For example, here's an actual doctor, Hina Rajdio, she's an MD, for example, joined a hospital system in 2011 after 30 years of being a partner in a 2-physician surgical practice. But she soon found out that she preferred independence to being someone else's employee. So she says, now I'm going to have to reinvest everything to get back into private practice. That's the sad part, Eric. They have to start from scratch once they go back into private practice after working for a hospital.
Yeah, absolutely. Patrick, I had a doctor come by my house today. I didn't even know he was a doctor. He was coming to buy something. We had something for sale. We had put it up on Craigslist, and they came by. After I got through talking with him, I found out he was a retired doctor. He told me at the end of his career, he sold out to a large, I won't name who they are, large hospital here in the Texas area. And he come to find out as he was retiring that the hospital said that he owes the hospital money, and if he wanted to leave and go start his practice over or resell his practice, he could not take the patients because the patients actually become owned by the hospital. He says, I asked him, can I record this for you today? It was amazing. But this is a real issue. And here we got this other gentleman here that again talks about some physicians are trying to return to private practice because their compensation from hospitals became less attractive after the expiration of their initial contract. And he goes on to say, after that honeymoon period, he says that their pay was based on the previous 3 years of their tax returns. However, after the contracts were up, the hospital switched to performance-based pay, which ended up being lower.
Bait and switch.
Bait and switch, folks. So a lot of you ask us here at ABS, what about these doctors being bought out by hospitals? Folks, what you've got to understand, as Patrick mentioned earlier, you're a consultant. Work with independent doctors to keep them independent. That's going to help you in your healthcare in your own area.
Eric, I know this has nothing to do with this webinar, but I must address a couple of statements or questions here by Hugh, because this is important. I'm sure this is on everybody's mind. They're listening to all these detailed facts and quotes and so forth that we're giving in this webinar, which is good information, I'm sure, but if they're thinking about getting into our business, what's the main thing on their mind? Am I going to be able to go out and actually do this, actually get a client? So Hugh says, I'll read it here. He says, getting to the decision makers in medical offices seems to be the crushing grind. I like that term. Do you have solutions or tried and true ways of overcoming this with your products? Then he goes on to say, another chat here, seriously considering it, though there are lots of close friends in the pharmaceutical, and device sales industry, I guess, that would caution me, saying that getting into the offices and practices is virtually impossible for the small fry. So Hugh, here's all I can say. You need to go back to our website under the regular website, absystems.com, and go to under news. There's a blog there. Go to the blog and search for the word interviews, or interview, singular. And you will see that I've done interviews with people that I would say, Eric, 99.9% of them have had no background in the medical field, no background in sales or marketing or owning their own business. And you'll hear the stories of our licensees who built this business. So can you do it? I don't know. It depends, right, on a lot of different factors. But the fact is that we have licensees who have done it, who have signed up as big a clients. Well, we've had some recently, 36 and 40 doctors in a group. But we get signups every day, so we know it's possible. And yes, the answer is in our training class, we do go through a dozen different ways that we have proven over the last 22 years as to how to get past that gatekeeper and get your information right to the doctor, him or herself.
Yeah, Hugh, that was a great question. Absolutely, that's how we do have tried and true ways. That's why. I can tell you of a lady that's down in Houston who was a stay-at-home mom. She was a homeschool mom just about a year and a half ago. Came on board with us, and today she's billing for, I think, her 4th or 5th doctor. So if you want proof, get with your ABS person that brought you here and talk to some of those people. We have plenty of people that you can talk to.
Yeah.
Patrick says he's interviewed some folks, but if you want to talk to those people, you can talk to our licensees individually and find out how they did it.
Yeah,
they'll be happy.
We could say anything that we wanted to try to get you convinced that this is the right business for you. But talking to people who've been out there, been there, done that. Hey, the instructor that we have come down in February, Cynthia Anderson, she started 8 years ago with us and had no background in the medical field whatsoever. Now she's got a huge business. She has people that run it while she's down here training for us. Yeah, you'll get to ask her all the questions you want during that live training class.
All right. Number 6, keeping pace with technology. MGMA says that their survey finds that the median cost of business operations, which including IT staff, is now above $52,000 per year per physician. Folks, when people have to deal with their own IT, the doctor's office, they're spending another $52,000 on average a year just to maintain their services. And if a doctor wants to go to a low cost or these free EHRs that are out there, Dr. Zetter says these products will work for some physicians depending upon their circumstances. But some practices have found that such EHRs fall short of their expectations. It's actually creating more work and more headaches for that. Again, our solution is the iClaim and EMRx. And again, all we can tell you at this point is sign up with us to at least see a demo of the system, and again, we'll be happy to do that with you. Patrick, let's talk real quickly about HIPAA. Again, that's the Portability Act, Accountability Act.
It's right there, Health Insurance Portability and Accountability Act. Folks, fines for the doctor for HIPAA violations can start at $100 and go as high as $50,000 per infraction, capping at a mere 1.5 million annually for the doctor, depending on the.
Yeah.
We have solutions for the doctor that can make sure that they don't breach HIPAA.
Yeah, and this is an attorney, and yes, that's his actual picture. You can go look him up, Daniel Shea, JD. He says that who focuses on HIPAA issues, and he says here's the issue: employees not willing, knowing what they're doing. We know that we're all on our phones. They're posting stuff on Facebook, and all of a sudden they'll take a picture of their lunch just to know that sitting up on top of a patient chart of their next door neighbor that has prostate cancer or something.
Oh,
and all of a sudden that gets out to everybody.
All I can say is serves them right. I don't want to see pictures of your lunch.
That's right. And then here's a little bit of where the fines will range, anywhere from 100, again, as Patrick says, all the way up to $50,000 per incident.
Yeah, and since 2009, Eric, there have been more than 800 patient data breaches and 29 million patient records affected by HIPAA violations, according to this Redspin breach report, it's called. So,
yeah.
Do we have a solution for that too? Yes.
We do.
We have a service.
Guard.
Yeah, we can provide protection for that medical practice against those HIPAA violations.
Yeah, and there is a cost. You can see the cost down there. It's for a single location, it's about $1,500 per year, but that's cheap insurance for that particular doctor's office.
Yeah, when the fines can be up to $50,000 each. Yeah.
Yeah, I mean, so we're talking about huge swings there. All right, implementing ICD-10. Again, we're kind of looking at the clock, making sure we'll probably go over just a little bit. So folks, hang in there with us. We're going to try to get as much as we can in here for you. But Patrick, ICD-10 started in October. Are the doctors still losing money?
Yes, because they still don't know what they're doing because they're antiquated systems that they're using, and the people that they have don't really know what those codes for ICD-10 should be. Those have been updated. Folks, just so you know, that's the International Classification of Diseases. It has to do with the diagnosis codes for doctors. That's how you can remember that. And here's a great quote here from Joshua Berman. He's the Director of Business Analytics and ICD-10 lead at Relay Health Financial. He says, I guarantee there will be one large payer or a few small payers, those are insurance companies he's referring to, or both, that won't be ready to process the claims on October 1st. Well, that was this past October 1st he's talking about, and sure enough, we found that was true of a lot of them. You can go search Google and you'll see a lot of insurance companies have failed to be ready for ICD-10.
So the solution for that is another one of our services called CodeWrite. And CodeWrite will help the doctors make sure that they are coding properly. Now, why this is important is because right now some of those payers, even though they're not ready, there is a little bit of a give and take here. But that window will continue to keep being closed in, and they're going to get more tight on making sure that the doctors are using proper codes and this, that, and the other. Right now, it's a little laxed, so it's there. But this is a continuation. I read one report today that this is going to continue all the way through 2016. So, folks, it's not too late to deal with the issue of ICD-10, and again, we have the solution for that.
You don't have to know anything about codes. We have certified medical coders, on board basically with us that can solve those problems for you and the doctor. All right, EHR/EMR. Let me define that for people. That's the electronic health records / sometimes referred to as electronic medical records. They're basically the same thing. But here we're talking about estimating the return on investments. And most practices are considering 4 cost centers: hardware, software, implementation, and training, and the software and support and maintenance of all that software. Folks, we take care of that. We have that solution too.
Right.
But look at the
and again, these costs. Yeah, look at the cost here. And these costs are still high, much higher than what ours would even cost a doctor for the entire year. So, folks, again, you can go study these on your own. You can certainly see the websites for you to go see all that. But again, our solutions that we have for these doctors is a very low cost, very high end type of webinar. I mean, type of system for them to, for us to, and for you to do the billing and have an EMR system all together that has all the proper codes. Everything's updated. They don't ever have to pay for an update. They don't have to have an IT person there that they have to pay $52,000 a year for either to provide this. It's all built in there for the doctors.
Yep. Remember,
and then lastly, Pat, oh, go ahead.
We've been doing this for 22 years, so we've got this down to a pretty fine art.
Exactly. And then the last thing that the doctors are being challenged with is not to say that there were 9 other issues out there, but the insurance companies themselves dictating healthcare.
Yeah, here's a Dr. Paul Swino who says, I knew it would happen because his mentors told him it would, and sure enough it did. I received my first request for an audit a few weeks ago from a Medicare chart. So folks, it's Medicare that's determining whether or not this doctor can perform a particular procedure on a patient. That's them dictating healthcare to the doctors, and they don't like that at all.
And we've got this young lady here, Tatiana, who is another attorney, who is saying that the federal government can audit Medicare patient charts while individual states can audit, for Medicaid patients, since they fund Medicaid up to 10 years after the patient's treatment. So, I mean, the doctor, just because the patient comes in and out of the office and they may go through 2015, who they saw this year, they could be audited up to 2025.
Yep.
And then this last quote from a local doctor here, Patrick. I mean, you can certainly talk about Dr. Block here.
Yeah, she says that she believes in the sanctity of the doctor-patient relationship. That third party, whoever it is, should not be in the middle of it. And believe me, they are. In fact, with Obamacare, all the insurance companies were for the Affordable Care Act because they knew that they would theoretically make more money because they could dictate what claims could be paid and what couldn't be. So, yeah. Hey, we made it. It's 4:02.
We did. We made it to the end. And folks, again, we don't want you to just take Patrick and I's word for it. But Patrick, again, you want to offer something that's far beyond just taking our word for it, far beyond just people picking up the phone and calling an ABS licensee and talking about it. Let's talk really quickly about your money-back guarantee here through the training class.
Yeah, folks, it's pretty straightforward. We don't use any weasel words in our guarantee. It says exactly what it means, and that is you come down here to our live training here in Dallas. We do it at a hotel out north of the airport here. And if at the end of that training workshop, for any reason, you don't think this business is right for you, just tell any of our staff and they'll arrange for you to receive a full refund of your license fee. Folks, every penny of that is given back to you. It has happened very few times in the 22 years, but that tells you that we're pretty confident in what we have to be able to offer that kind of guarantee. And believe me, once you have been to their training, you'll see that we have got something very special here.